At the present time, the therapies are, for short bowel syndrome, are really in a couple areas. One is surgery. So if there's a blockage, a surgeon can operate and try to fix it. Or if the child's intestines are not functioning well, feeding intravenously. But we really don't have good medications that can grow more intestine. That's really what you'd want to do. I mean, over time, a child tries to compensate on its own, and the intestine grows as a child grows, and oftentimes there is some growth of the intestine, we call that adaptation, that allows a child to digest better and better as it gets older. But it's a very slow process, and sometimes it's insufficient. And so we really need medications that can improve the function of the intestine, can improve digestion so the child can get more nutrients and more energy out of the food that it does get, and also increase the amount of intestine a child may have, which is something that our present technology cannot do. In a problem such as short bowel syndrome, where you're talking about very small infants, you're talking about very sick situation, they often have multiple problems, not just the intestine, but the liver, brain development, lung development. And the problems are sometimes dealt with by surgery, with a surgeon. Sometimes they're medical problems and a medical doctor treats the patient. But there's a lot of science that needs to be done. We don't understand all the ways the cells within the intestine talk to each other, and that's probably very, very important. Cells sometimes talk to each other and tell each other to do things. We would like a way to tell those cells to grow and get bigger and do a better job. And that not only takes physicians, but it takes scientists who understand how cells talk, and it requires teams. It requires teams made up of physicians, surgeons, nurses, scientists who understand how cells talk, also scientists that understand how to make drugs. Sometimes we know how cells talk to each other, and we actually have a molecule or a candidate medication that does a job between those cells, but turning that knowledge into a pill, for example, that a patient can take, it takes years of work and often millions of dollars. And so we really need teams of people. Some of them are chemists, some of them are experts in how cells talk, some of them are physicians, surgeons, nurses, to work on these problems together. A problem as tricky and difficult and as long-lasting over many years as a small infant short bowel syndrome really requires a team approach to develop new treatments.